Alrighty. So now, doctor, you can tell us the differences between the IBS and Crohn's disease, which is a IBD disease.
Yes. Actually, inflammatory bowel disease includes two major diseases. One is called Crohn's disease and the other one is called ulcerative colitis. Here in the valley, we see more ulcerative colitis than Crohn's disease. And so I'm going to tell you the difference between IBS and inflammatory bowel disease.
Excellent.
As I mentioned earlier, that in the irritable bowel syndrome, the symptoms of recurrent abdominal pain, and then it can be associated with some defecation and also change in the bowel habits, which will include diarrhea or constipation or the combination of both. We don't see bleeding there. We don't see fever there. We usually don't see any weight loss. So, this is the typical symptoms of the IBS. And as I mentioned earlier, that it is not associated with long-term consequences, meaning it will not cause any cancer or anything like that. However, the condition is very different with IBS, which will include both Crohn's and ulcerative colitis. The symptoms are diarrhea, abdominal pain, bleeding, fever, weight loss, and especially with Crohn's disease, like it is a little bit different from ulcerative colitis in the presentation, that Crohn's can present with intestinal obstruction and sometimes the fistulas. Ulcerations in the mouth. And Crohn's can affect any part of the GI tract, as Dr. Cooper just mentioned, that it can involve any part of the GI tract, including mouth, all the way to the rectum. Whereas ulcerative colitis is solely a disease of the colon.
Very good, very good.